glad for it. The aim of this research to reduce polycystic ovary syndrome as much as possible by a healthy lifestyle. So let us know what is PCOS. Polycystic ovary syndrome is a hormone imbalance that can cause irregular periods, unwanted hair growth, and acne. PCOS begins during girl teenager years and can be mild to severe. PCOS cannot be completely cured. Its symptoms can be managed. The most important symptoms to treat is insulin resistance because of its association effect on androgen, the hormone that are produced in excessive amount in women with PCOS and directly affect normal productive functioning. Overcoming insulin resistance has a positive carryover effect on other PCOS symptoms such as infertility, acne, and mood swings. So let us know what is the main causes of PCOS. Polycystic ovary syndrome is caused by an imbalance in the hormone chemical messengers in your ovaries make estrogen, progesterone, and testosterone. Adrenal gland, kidney, pancreas, uterus, vagina, thyroid gland, parathyroid gland, brain pituitary, located at the base of the brain, send LH and FSH to the ovary. Brain and your ovary. PCOS actually happen when hormone called LH from the pituitary gland or level of insulin from the pancreas are too high, which then cause the ovary to make extra amount of testosterone. So this is the main causes of PCOS. Let us know what is the sign of symptoms of PCOS. Some of the most common signs of PCOS include irregular periods that come every few months, not all or too frequently, extra hair on the face, on the other parts of the body called peristome, acne, weight gain and trouble losing weight, and patches or dark skin. If you have some or all of the above signs, you might have PCOS. There can be other reasons why you might have signs. However, only your healthcare provider can tell you for sure. So let us know what is the test will make healthcare provider to do diagnose PCOS. Your healthcare provider will ask you about a lot of questions about your menstrual cycle and your general health, and then do a complete physical examination. You will most likely need to have a blood test to check your hormone levels, blood sugar, and lipid, including cholesterol. Your healthcare provider may also want you to have an ultrasound test. This test that use sound waves to make a picture of your reproductive organs, ovary and uterus, and bladder, where your urine is stored. In a girl with PCOS, the ovary may be slightly large, often 10 cc in a volume, and have multiple tiny sites. So let's know what's the treatment of PCOS, or we can call it MNT, medical nutrition therapy. The most important treatment for PCOS is working toward a healthy lifestyle that includes healthy eating and daily exercise. The best way to overcome PCOS is by following the diet design to improve insulin resistance. In the same way that a poor diet can cause increase in insulin, the right diet can help lower insulin level, preserve insulin resistance. Eating the right food may also reduce your risk of developing any long-term health problem linked with PCOS, such as heart disease, impaired glucose tolerance, and type 2 of diabetes. A diet rich in a natural nutrient-dense food, including lean protein, fresh fruit and vegetables, healthy source of good fats, and slow digesting complex carbohydrates is your best line of defense. The new meal regimen should encourage natural weight loss as well. It's been shown that losing just 5 to 10% of total body weight can increase insulin sensitivity. When following the PCOS diet, it's important to respect certain rules to increase your chance of success. This includes the specific type of food to eat, but also the type of food to avoid. To greater manage your PCOS symptoms, you should adhere to the following rules. Eat regularly every 3 to 4 hours. Follow this rule, stabilize your blood sugar level, and regulate to proper functioning of insulin production. Eat when you are hungry and stop eating when you feel satisfied. Avoid food that your parent would not recognize. Fast food, packaged snacks, soy products, and high fructose corn syrup contain chemicals. They can interfere with the body's typical insulin response. Always choose natural whole food with over their processed, refined, and countercurrents. Eat lean protein, complex carbohydrates, and healthy fats at every meal. This will slow down digestion and ensure gradual, steady release of insulin. Eat organic produce wherever possible. If you choose to consume dairy, make sure it's organic. Meat, poultry, and eggs should also be organic and grass-fed. So actively avoid food that are fake, processed, or contain added sugar. Pay particular attention to the following food. Refined processed carbohydrate, including refined sugar, white flour, and rice. These products contain high amount of toxin and chemicals. They also digest quickly and spike your blood sugar levels. This can cause stress to the pancreas and interfere with regular insulin production. High fructose, corn syrup, and trans fat, both groups promote insulin resistance and increase the risk of developing type 2 of diabetes. The former is found in foods such as breakfast, cereal, juices, and soda, while the latter is found in chips, candies, cakes, and margarine. Dairy and gluten. These foods can cause insulin resistance and also increase inflammation, limit normal testosterone processing in the body, and destroy gut health. So what about lifestyle? We have to do an exercise. This is first of all. Obesity is widely recognized as a PCOS, so managing a healthy weight, especially abdominal circumstances, is recommended. Exercise helps us to reduce many PCOS symptoms such as depression, inflammation, and excess weight. In addition to exercise, increase daily activity by taking the stairs, going on short walk, and stretching throughout the day. No matter the movement, stay consistent and choose an enjoyable activity. Women may want to limit inflammatory foods such as dairy product, food with gluten, and food high in glycemic index. Loud such as potato, white bread, and sugary desserts as much as possible. But if these foods do not cause badly aggravation, then there is no need to eliminate them completely. Thank you for your attention. So if you have any question, you are welcome.